In the house, a remarkable story to share of a patient that told us,
I didn't talk to anybody about it at first because I was kind of embarrassed.
We'll share more on a surgery that she says has given her back an important part of her life. Stay with us. And now to why Dr. Amy Brenner is in the house. We're glad to have her here today. She is here to share more on part of a cosmetic surgery that is called, or the whole field of it called Cosmetic Gynecology. And you had an amazing patient that talked to us. We're going to share a little bit more on her story, which helps us explain it.
So I started my initial research of this entire process or procedure back probably when I was 15. That's when I started feeling self-conscious about my body.
Her name is Kim, and for years she was bullied because an area of her body, often seen by others perhaps only in the changing room, at a locker room or a swimming pool, looked a little different.
They can say hurtful things and they not even realize that they're hurting somebody, like just because of how they look.
Kim admits it took years to finally reach out to Dr. Amy Brenner and Associates.
I didn't talk to anybody about it at first because I was kind of embarrassed.
But Dr. Brenner, a women's health surgeon with specialized training in cosmetic gynecology, says she is not alone.
It's the most rapidly growing area of aesthetic medicine.
Part of the reason Dr. Brenner says these simple in-office outpatient procedures are more and more in demand.
I think there's just a big paradigm shift in the world of people are getting more comfortable talking about sexuality, talking about what it looks like in their female genitalia, because there are things that can be done if it's something that really bothers you.
In most cases, what can be done tightens, alters, or removes excess tissue, which changes a desired appearance and sometimes improves function. In Kim's case,
I'm curious how much changing the outside helped change the inside.
Oh man, drastically. I'm more confident in my own skin. I can wear tight clothes and not feel like everybody's looking at me, even though I know they weren't, but I was looking at myself. I knew it was there. I know next summer I'm going to feel fine going out in a bathing suit without board shorts because I'm going to feel comfortable in my own body. It just overall has made me feel so much better.
So joining us now with What's New in Medicine, Dr. Amy Brenner, welcome to you.
Thank you for having me.
You know, thank you for finding that awesome patient. And, you know, what we didn't get to show you is that off air, she came in just, you know, so grateful to you for something that to the rest of us might seem like no big deal. And are you just finding that when people come in with this, there's so much sort of hurt inside?
Yes, her story just really warmed my heart of how grateful she was and how this really changed her life. And I've been doing this surgery for a while now, but just hearing her story of her talking to you, sometimes I get focused on the medicine aspect of the surgery, but really taking a step back and understanding how important this is to women and how it can not just change a aesthetic appearance, but just change so many other aspects of their life.
Yeah, she said that, her confidence, all kinds of things. Okay, so I've been asked a ton of questions since we aired the story. I'm going to ask you some of those. We have a graphic that talks about cosmetic gynecology in general. What is that field? You know, when I looked it up, it says it's considered aesthetic surgical corrections, which means appearance.
That's correct. Changing the look of our gynecological organs. So of the outer labia, the labia minora, the labia majora, just what the perineum looks like, or even tightening the inside or tightening the vagina.
So you enhance sort of what they call the genital structures, and labiaplasty, when I looked up, is the most common procedure. So what is that?
So we have two labia. We have our bigger labia majora, or the outer lips, or the smaller inner lips, the labia minora. And I would say the labia minora is the most common cosmetic gynecological surgery that I'm performing.
And in the case of our patient, you know, she just said, like, she just sort of, for lack of a better way to say it, had an abundance of tissue. Is that a way, kind of a way to describe it? And you can sort of tighten it up?
Not so much tighten it up, but what we're doing is surgically excising the excess tissue that women want to have removed because they believe that it's just too much or uneven or getting in the way of clothes or falling out of bathing suits or things like that.
Mm-hmm. And so then the next question that comes up is, does it hurt?
Surprisingly, it is a surgery, so for some women they do have more discomfort than others, but I've also had some women who don't even take any pain pills. So we have a nice protocol that allows us to do this in our office under local anesthesia.
So it's topical numbing, you get them through that. Now, one of the reasons I wanted to have this conversation, and I'm sorry if you're like eating breakfast and this isn't what you were thinking of discussion, but this is what this show's about. It's about hope and healing inside and out. And when you hear these stories, our patient actually said something else. I just wanted to play something from her interview.
There's a ton of people out there.
Yeah.
Yeah, and I don't think a lot of people know that this kind of stuff is out there available for them. So I'm hoping that this kind of helps them if they're going through what I went through, and I hope it helps them realize that there's stuff out there that they can do.
I think the biggest reaction that I've had is just that there's something you can do, that no one hears about this because we are not talking about it.
I think you're right, and what I found is so many women have been considering this, wondering if there's something to do for many years before they even come into our office, and it's a big step for them to come into our office, and then usually after the fact they're like, that wasn't that bad at all, and I'm so glad that I reached out and know that there's something that can be done.
Right, and you make it private and comfortable, and you treat them in a way that it's well respected, and probably they kind of don't feel like, oh, I'm, all that unusual once they talk to you, because you see a fair number of common problems like that.
Yes, we do, and we like to show them our before and after pictures and let them know that there's a lot of other women that have undergone similar types of surgeries.
And by the way, you get permission from those women because they're so happy too to show those pictures. You wouldn't think like, hey, I'd want to share that, but they do, don't they?
Almost all of them do, because it was important for them to see the kind of work that we performed and let them know kind of also kind of choosing what their outcomes are going to be. So our before and afters have really helped them, and most people like this patient want to help other women in their journey.
Yeah, I do think there is a special place in heaven for women that help other women. So we're grateful that they're doing that. Okay, I know that there is a cost involved that's usually not covered by your medical insurance plan. I know you work with patients on that. And we do have a link to more information at local12.com. Some of those roughly in line with like sort of the breast augmentation cost, that kind of thing?
Yes, usually are starting around $4,000.
And once it's done though, you usually don't have to redo. I know with breast augmentation, they say get ready for the next one when you have the last one.
Yeah, not usually.
Yeah, we're done. Well, thanks for what you're doing. Thanks for this awesome special training and having it here in our community. And we'll continue to refer patients back to you, Dr. Amy Brenner.
Thank you for having me.
All right, coming up next.